Hi there, it's Dr. Renee. So here I am with the first of my weekly vlogs, and as I promised, my first one is on anxiety. So, why anxiety? I think it's a really important topic, and I think lots of other people agree with me, and it's slowly becoming more acceptable to talk about it, and I want to make it absolutely acceptable, normal. No one should feel ashamed of having anxiety. We've seen loads of celebrities come out and talk about their anxiety, which is brave and it helps the cause, and that's brilliant. But as a GP, I am seeing people day in, day out, I promise you, every single day without fail, at least one patient with anxiety, who've been suffering for such a long time, far too long before they've come to me. And that's what I want to try and break. I want people to get sorted sooner. And why do they wait so long? Well, I guess it's stigma, isn't it? Anything that's got mental health attached to it, people feel a bit embarrassed about. You know, they feel they should man up, cupcake, just cope a little bit better, not talk about it, knuckle down, and stop failing. People feel that they're failing because they're not coping. Well, you're not failing. You really aren't. Lots and lots of people suffer with anxiety. Doesn't matter how good their life looks on the outside, it's what's going on inside that matters. I suffered with anxiety, and I'll tell you about it later. But that's the reason I want to talk about anxiety. I want to sort out the stigma, change the way things are looked at, and make it easier for people to go forward and speak to their GP. So what is anxiety? Firstly, it's completely natural. You know, when faced with something scary or something that creates a fear, anxiety is the body's natural response to try and take you away from it, so it's protecting you. I was a bit anxious before making this video today. Hopefully when it's over and it's all okay, I won't be anxious anymore. But for some people, that level of anxiety never goes away, or it's there repeatedly throughout the day. And as I said, it doesn't matter how good life looks, it's what's on the inside. And Adele has shown us recently just how true that can be. She's talked about her fear of audiences, and yet it's what she does. She sings to audiences. So much so that at one particular concert she climbed out of a window and escaped down a fire escape. It sounds crazy, doesn't it? But it isn't. That's what anxiety does. It makes people irrational. And it doesn't matter what's going on. Anyone can suffer. So, as I said, I suffered about 15 years ago. Life was good. I had a marriage, a nice home, a lovely son. I had a really good job. I was going to all of these okay parties. Life was good on the outside. But I was having panic attacks, and I actually used to believe that if I didn't tell myself to breathe, I'd stop breathing. Completely irrational, and obviously I didn't stop breathing because I was still here, but it was awful, really awful. So let's not judge anyone. Anyone can suffer from anxiety, and it can make that much of a difference to their life that we need to sort it out, and we can sort it out. So what are the symptoms of anxiety? The first thing to know is it's unique to everyone. Everybody's symptoms are different. Mine was about breathing. But you can be sweating, shaking, have tingling in your fingers, feel like you can't breathe, palpitations. Some people collapse. Some people have chest pain so bad they think they're having a heart attack. Ellie Goulding has said that her panic attacks made her feel like she was having a heart attack. And in my GP surgery, I see people often come to me and think that something is wrong with their heart. That's how bad it makes you feel. And that's why we need to do something about it, because people shouldn't be feeling like this. So the thing about anxiety is not only is it unique to everybody that suffers, it's not predictable. So some people can predict when they're going to feel anxiety, and they know that they have triggers like crowded spaces, tube trains, meeting new people, meeting friends, going out of the house, going to work, just simple things that you and I take for granted. People can't do because their anxiety is so great when faced with those problems. But they can identify those triggers. Other people can't. So other people feel anxious all of the time. So this heightened fear and panic and sweating and anxiety and all of those symptoms, or whatever they are for the person suffering, are there all of the time. This is called generalised anxiety disorder, and it's more difficult to identify triggers, but the effects are just as devastating, maybe even more so. So those are the two different types of anxiety that we see in GP. So what causes anxiety? That's the question I get asked all of the time. Well, it's the fear of an object, a place or a feeling. And it's likely a combination of physiological, so the way that your body works internally, with psychological, and learned experiences as you grow up. Those things come together to somehow give you these levels of anxiety in whatever form they are. Obviously things can happen in life that trigger anxiety. So when I mentioned my panic attacks out of the blue 15 years ago, what I didn't mention was I was going through some pretty serious surgery and some radiotherapy. And so although life was good and I was getting on with it, which I was, I had some fairly traumatic stuff going on in the background. And that manifested itself for me in panic attacks. So people can go through life absolutely fine. I was 33. Up to that point, I'd had no real anxiety. They can go through life absolutely fine, and then something can trigger it. So a traumatic event, be involved in some sort of horrible event, and we've seen enough of those in London. Someone close to you dying, losing a partner, a relationship breaking up. Any of these things can trigger anxiety or panic attacks, and it doesn't matter whether you never had them before. If you have them now, let's sort them out. So the treatments to sort them out, and that's what I really want to get to today, because I think people don't often think about it. They think there aren't any treatments. Well, there are. And there are two types of treatment in the main: talking therapies, so psychology, and medications. And we often use them on their own or together, or a combination of all sorts of bits of each one. And again, it's finding out what works for you, because you and your anxiety are unique. And that's where a GP is really, really good. And we really are nice people, honestly. You can come and open up to us and we won't judge. We'll listen and we'll work out a plan with you, for you. So talking therapies is probably the mainstay of treatment for anxiety. It's certainly a good start point. And often for some people, just talking about what's causing their anxiety or how they feel is enough. And bear in mind, this is stopping people doing things that you and I take for granted. Going to work, going out for a drink, socialising, going on a tube train. It's stopping life. So talking about it is the first step, and admitting that that's causing you problems is a really good step to take. And from there, quite often we use something called CBT. And patients often say to me, what is CBT? And this is how I explain it. So imagine a field of long grass is your brain, and you've got something happening that's causing anxiety and you need to get away from it. And you look at the field and there's a path. It's already trodden, the grass is all flat and it's really clear, excuse me, and you take that path, trying to get away from your anxiety, but unfortunately you've trodden that path so many times before that at the other end all there is heightened anxiety. So what to do? You need a new path, one that takes you away from the anxiety, and at the other end there's only nice things, not more anxiety. But in order to make that new pathway through the field, through your brain, is hard work, because you've got to tread the grass down, you've got to make a path that no one's ever gone before, including you. And that is where the really hard work is. But when you get to the other side, the reward is great, because you've not taken that path that's taken you nowhere in the end. It's taken you to a new place that's nice and anxiety free. So that's what CBT is. But I always warn patients that treading down that grass and making that new path in your brain is hard, because it's natural to want to take the easy path. But it's worth it, so persevere, because it really can work. So that's really talking therapies and how they work and the mainstay of it. Then we have medication. And for some people, medication works alongside talking therapies, after talking therapies, or even for some before they've even started talking therapies. Talking therapies are not for everyone. I'm not sure that they're brilliant for me, because I'm really hard-headed and I probably would think I knew better. So for me, I might choose a medication pathway. So when I'm talking to patients about medication, I tell them about two different types of medication. There are some anti-blood pressure tablets called beta blockers that work really, really well. And there are antidepressants, the SSRIs, and they work well as well, but in a different way. So I quite often start with a beta blocker, and I do that for some very simple reasons. You can use beta blockers in many different ways. So again, you've got this unique patient, you or me, with unique symptoms and manifestations, and you can tailor this medication to suit them. So for some people, just having the medication in their pocket, in their purse or their bag is enough to stop the anxiety coming, to stop the panic attacks. We call that the pill in the pocket approach, and for some people it works brilliantly. For others it's not quite enough because they still get the panic attacks. So if they can identify their triggers, it often works quite well to take one of the beta blockers before you're approaching that trigger. So if you know that you've got a big social event that's going to cause anxiety, or a presentation at work, you take the beta blocker when you need it before that event, and hopefully you then cope with it in an entirely different way, in a calmer way. And then for other people who can't identify their triggers, so they've got this generalised anxiety, we give them beta blockers 3 times a day, every day, and that then keeps everything settled across that time, and beta blockers do work well. Some people can't have beta blockers if they've got other illnesses like asthma, for example, so be sure to let your GP know, or the doctor you're talking to, everything in your history as well, so they can make sure it works for you. So alongside this we have the antidepressants, and I mentioned the SSRIs. You'll probably know them as citalopram, sertraline or fluoxetine. And these work really well for anxiety, especially anxiety that's got an element of depression alongside it. And that's really common as well. Either the anxiety itself is leading to the depression, or the depression is triggering the anxiety. The thing about antidepressants is you need to take them every day, and they don't work for about 3 to 4 weeks. So it's a commitment, but the reward is there. And I always say to patients, hang on in there, because you will start to feel the benefit after 3 to 4 weeks. And I always assess patients again at this time to see how they are. And the other important thing is that you don't stop them suddenly, because ironically you can get an anxiety from stopping them. So once you've actually started on an antidepressant, stay with it, and also if you're going to come off it or want to come off it, see your GP and do it together so that they can manage that for you and make sure things don't get worse, because that would be the last thing that we wanted, wouldn't it? You go to be treated for anxiety and then it gets worse. So there are different tools available here, and quite a few, and the combination of them together, medication or talking therapies, can really offer different solutions for everybody who has anxiety. Some people find their own way of dealing with anxiety, and some celebrities have spoken about how they do it. For example, Tanya Burr has said that she gives Martha, her little dog, a cuddle when she's feeling anxious, and that's soothing, and we know animals are soothing. She goes and has a nice hot bath, or she takes some alone time. Jennifer Lawrence has said that she creates an avatar of herself in her head and goes to that and imagines herself to deal with the anxiety, and that works. Other people throw themselves into their work, they exercise, and we know exercise works really well for depression and anxiety. So I think the message is, if it works for you, then go for it, because that's all that's important to a doctor. They're not ideally looking to give you medication or any particular treatment. They want a solution that works for you. I do anyway, that's for sure. If it works for you, I'm happy with it. So hopefully today what I've managed to do in a very short period of time is let you know that sharing with your GP is the major hurdle that you can overcome to actually be on the road to recovery and treatment. It's a confidential setting. You can tell them anything. They're nice people. I'm a nice person. I like to share with my patients. I like helping them with their anxiety. It gives me a real sense of achievement when we manage to do it together. And it really is a together. It's not me sorting it. We're doing it together. And there are lots of different tools available. Sometimes just talking and sharing, a problem shared, as they say. So please, if there's one thing you take from this video today, it's that anxiety is an illness like any other, and it deserves the same kind of respect and attention of any other illness. And there is no stigma. It's just, you know, something that goes on in this world we live in today that is a very stressful world. And you are not alone. Trust me, you are not alone. I see this day in, day out. And I treat it day in, day out. And you could be one of those people. So, I hope you've enjoyed the video. If I haven't answered the questions that you've got, post them after the video and I'll answer them for you. And if you've got suggestions for other topics that I can cover, I will happily do it. So post those as well. And hopefully over the next few weeks, months, who knows, we can get to know each other and I can answer the questions that you've got about important things in your life. And now the video's over, hopefully my anxiety levels will have gone right down. Thanks for listening. Bye.